In 2015, Mayo Medical School is partnering with Arizona State University to take a bold new approach to medical education through a comprehensive science of healthcare delivery curriculum.
The science of healthcare delivery is critically important for the next generation of physicians. It will provide them a new fund of knowledge, new skills, and new attitudes that will help them better serve patients and populations.
How do we maximize value from the patient's perspective? How can we ensure that patient care is coordinated and not fragmented? How do we make sure we're providing ideal care based on the best science? Focusing on these challenges requires a fundamental change in the way medical students are educated.
Teaching the science of healthcare delivery for our medical students and really providing them expertise in this area, I believe will differentiate them among the other medical students in the country and will help them become the physician leaders of tomorrow.
Improving healthcare delivery is more important now than it has ever been, given the universal awareness of the many challenges in U.S. healthcare today.
So we have a paradox in the United States. We have some of the best examples of healthcare in the world, actually. And we have mediocre and very poor examples of healthcare, so that the United States as a country, on average, is not getting the outcomes, the safety, and the service for the amount of money that we're spending. That's the #1 problem that we have in this country.
Out-of-pocket expenses are higher than they've ever been, especially for a commercial patient or an uninsured patient. And so I don't know what I'm coming in to receive, and oftentimes the caregiver can't tell me how much it's gonna cost. And so if that person comes in and gives me 5 minutes and just tells me what they're gonna do, not why they're doing it, it really seems like they're cheating me out of the opportunity to make a choice.
We need to change the way we're providing care. We have to change the way we are measuring how we provide care. We need to change the way we think of taking care of people so that we can keep them healthier and in better overall medical condition for their whole life.
The science of healthcare delivery curriculum will help doctors and other medical professionals improve the patient experience. It leverages the combined strengths of Mayo and Arizona State University to create comprehensive content informed by real-world experience.
The exciting thing about Mayo and ASU working together with this new curriculum in the science of healthcare delivery is that we will merge new systems and new ways of thinking into a new design which will produce fantastic new outcomes.
Imagine bringing together the teacher scientists of Arizona State University from their many different academic disciplines, such as the social sciences, humanities, engineering, business, and more, and combining that with the physician scientists of the Mayo Clinic.
The most innovative organization in healthcare in the country, Mayo Clinic, now links up with the country's best example of a new, high-speed, highly innovative, highly adaptive, flexible university. You bring those two things together, and out of that, you get the opportunity for complete new designs and complete new outcomes related to healthcare and health solutions.
The curriculum is carefully designed to address the factors that influence the health and delivery of care to patients from a number of perspectives.
We've built the science of healthcare delivery curriculum around 6 concepts or domains which we believe are critical to preparing the next generation of physicians and physician scientists to meet the challenges of American healthcare in the future. Person-centered care looks at healthcare from the perspective of the individual patient, that critical relationship between patient and physician.
It's taking a much more individualized or personalized approach to the care of the patient.
Students will learn how to reach out to patients, communicate with patients across literacy barriers, cultural barriers, lifespan barriers, and will also learn things such as shared decision-making, how to advocate for individual patients regarding their care.
So in population-centered care, students are learning such things as social and behavioral determinants of health, health disparities, health inequities.
Students will really focus on the things that impact the health of a population and how physicians can intervene in a positive way to improve population health.
Another critical dimension is high-value care.
In this particular domain, students learn about how to optimize patient outcomes, as well as the patient experience while minimizing the costs of care.
Helping medical students learn the concepts of evidence-based medicine, improving quality, reducing errors, all of that's in that high value domain. And it's vitally important that we train our medical students to learn this when they're in their formative years.
Health policy, economics, and technology will focus on external forces and systems that influence the practice of medicine.
Things like governmental policy, governmental legislation, health law, health economics.
We are using more and more technology to help take care of patients, to improve the care that we deliver. And so really having our students understand the fundamentals of electronic health records and other ways in which we use technology to improve patient care is very critical.
Team-based care is about ensuring that care is not fragmented.
We teach students how to build effective, coordinated, high-performing teams within healthcare and what the role of the physician is in each of those teams.
Leadership focuses on skills that physicians and medical professionals need to ensure healthcare teams provide the best possible care to their patients.
We provide some personal development for our students to develop their own leadership styles in order that they could lead high-performing teams.
How to manage people, how to inspire and motivate people, which are very important in healthcare.
The skills and knowledge learned through a traditional medical education are still vitally important. But to be successful, 21st century healthcare professionals need more.
With all the changes in medicine, I think it's apparent to many of us that the time is right to change the way we educate our nation's physicians.
The science of healthcare delivery will help you think about how do you create value, safer care for your patients at lower cost, and making sure that they get the best possible experience. That'll help you be a better physician.
You're going to be empowered in science, in medicine, in economics, in engineering, in systems engineering, in problem solving. Don't worry about it. It's going to be worked out. It's going to be seamless, and you're going to be unbelievably empowered.
And to really establish yourself as a leader in this field, I think that this is the program, the best way to be a real systems game changer.